The world seems tinted with gray. Happiness feels so distant.
I always have this nagging feeling something terrible will happen. Even in the happiest moments.
The echo of trauma. Understanding PTSD symptoms. Life, in all its unpredictability, sometimes places us face to face with deeply distressing experiences. These moments, be they brief or prolonged, can leave an indelible mark on the psyche, echoing through time long after the actual event has faded. This prolonged resonance of emotional and psychological distress is formally identified as post-traumatic stress disorder or PTSD. More than just a medical terminology, PTSD represents the very real and prolonged struggles of individuals who must navigate the world, carrying the weight of past traumas with them. With millions affected globally, understanding PTSD is crucial for both individuals living with it and their community. According to a report by the World Health Organization in 2019, about 3.6% of the global population has experienced PTSD at some point. When we translate this percentage into real numbers, it corresponds to a staggering 277 million individuals worldwide. Looking closer to home, in the US, around 8 million adults are grappling with PTSD annually. The data further suggests a gender disparity, with women being twice as likely as men to experience the condition. PTSD can be triggered by a myriad of traumatic events: natural disasters, personal assaults, severe health scares, or witnessing terrifying incidents. Yet, one of the most significant challenges faced by those with PTSD isn't merely the symptoms, as debilitating as they can be, but also the societal misconceptions surrounding them. Often, those with PTSD are faced with incomprehension or insensitivity, encapsulated in comments like, "Just move on," or "It can't still be affecting you." Such sentiments highlight the urgent need for widespread understanding. The journey toward understanding PTSD isn't exclusive to those who experience it firsthand. It is a collective responsibility. Families, educators, friends, and society at large must be equipped with knowledge and empathy. As we embark on this exploration into the realm of PTSD, our aim is clear: to demystify, to understand, and to support those who bear its weight daily. In the world of music and entertainment, few shine as brightly as Stephanie Joanne Angelina Germanotta, better known by her stage name, Lady Gaga. With countless accolades, chart-topping songs, and a dedicated fan base, Gaga's prominence in pop culture is undeniable. Yet, beneath the glam and glitter, lies a story that resonates deeply with the very theme we're exploring: the echo of trauma. In a 2016 interview on The Today Show, Lady Gaga publicly disclosed her personal battle with PTSD for the first time. Gaga's struggle began after she was sexually assaulted at the age of 19, an incident that left deep emotional scars. Lady Gaga's journey is a testament to resilience, determination, and the importance of seeking support.
Disclaimer. This video is intended for educational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. Let's now continue our journey to better understand mental health.
Through her Born This Way Foundation, she has since channeled her personal struggles to advocate for mental health awareness and empower youth. Following the harrowing revelation of an icon like Lady Gaga, a renewed interest sparked in academic and medical circles to dissect the intricacies of PTSD further. Scientific studies have illuminated the biological, psychological, and social dimensions of the disorder, yet there remain gaps in our understanding that need addressing. One of the landmark studies in the field was led by the National Center for PTSD, which highlighted that the hippocampus, a part of the brain responsible for memory processes, appears smaller in size among those with PTSD. The question then arose: does trauma cause this reduction? Or does a smaller hippocampus make one more susceptible to PTSD? While this chicken and egg debate remains unresolved, what's clear is that PTSD has tangible neurological implications. Moreover, a study published in the American Journal of Psychiatry in 2017 examined the prevalence of PTSD in different populations. The results were startling. While 6.8% of the US population had experienced PTSD at some point in their lives, the prevalence was notably higher among populations exposed to trauma, with military veterans being at the top, with a staggering 30% prevalence rate. However, there's a gap that's often overlooked. The majority of studies, naturally, focus on adults, leaving a dearth of knowledge concerning PTSD in children and adolescents. While it's estimated by the Child Mind Institute that over 5% of kids and teens in the US will suffer from PTSD in their lifetime, comprehensive research on early interventions, symptomatology variations with age, and long-term implications in this demographic remains sparse. A poll conducted by Kaiser Permanente in 2018 revealed that, while 80% of Americans know about PTSD, only about 30% understand it is not limited to veterans. Misconceptions, stereotypes, and stigma persist, often overshadowing the nuanced understanding that scientific research offers. Delving deeper into the realm of PTSD, a clear comprehension of its facets is crucial. Beyond the overarching term post-traumatic stress disorder, there exist nuanced types that manifest differently, reflecting the multifaceted nature of human trauma and its aftermath. 1. Classic PTSD, or chronic PTSD. This is the most commonly recognized type. Symptoms often include recurrent, intrusive memories of the traumatic event, nightmares, and flashbacks. Additionally, individuals might exhibit avoidance behaviors, steering clear of anything reminiscent of the trauma. 2. Complex PTSD or CPTSD. A more recently identified subtype. CPTSD emerges often from prolonged exposure to trauma, like extended periods of physical or emotional abuse. It shares many symptoms with classic PTSD, but also includes additional ones such as difficulty controlling emotions, feelings of detachment, and a pervasive sense of shame or guilt. 3. Acute stress disorder or ASD. As per the American Psychological Association or APA, ASD is a time-limited condition, with symptoms lasting from 3 days to 4 weeks following the traumatic event. While it shares features with PTSD, such as flashbacks and nightmares, ASD often includes dissociative symptoms, like feeling that things are unreal or being detached from oneself. 4. Uncomplicated PTSD. This type primarily involves a persistent re-experiencing of the traumatic event without the additional layers of symptoms seen in other subtypes. It is, however, as disruptive and requires as much attention and care as any other form. The echoes of trauma can be profound and lingering, but they aren't insurmountable. With a combination of evidence-based treatments and supportive interventions, many individuals with PTSD find not just relief, but the chance for a renewed sense of purpose and wholeness. 1. Behavioral therapies. At the forefront of treatment modalities for PTSD is cognitive behavioral therapy or CBT. Two specific types of CBT often used to treat PTSD include cognitive processing therapy or CPT and prolonged exposure therapy. 2. Medication routes. Pharmaceuticals can be an essential component in the treatment regimen for some. Two primary categories are antidepressants and non-stimulant medication. And 3. Therapeutic benefits beyond symptom control. Therapeutic interventions often extend into teaching organizational skills, time management, and coping strategies. The journey through understanding PTSD, its manifestations, diagnosis, and treatment illuminates one overarching truth. While the scars of trauma can leave an indelible mark, there is an immense reservoir of strength, resilience, and resources available for recovery. Here are some recommendations. 1. Early intervention. For those who've experienced trauma, seeking immediate counseling or therapy can significantly reduce the onset of full-blown PTSD symptoms. 2. Build support systems. The American Psychological Association suggests that a strong support system is a crucial pillar for PTSD recovery. This could be in the form of support groups, trusted friends, or family members, who provide a safe space for sharing and understanding. 3. Educate and advocate. Organizations like the National Center for PTSD offer resources for both individuals and their families. And 4. Holistic approaches. Techniques such as yoga, meditation, and controlled breathing exercises can act as auxiliary treatment methods, complementing mainstream treatments. PTSD, often termed the invisible wound, is a testament to human vulnerability and resilience. The echoes of trauma, as harrowing as they might be, also present opportunities for growth, transformation, and a renewed appreciation for life's fragilities. With a commitment to understanding, empathy, and informed intervention, society can play a pivotal role in turning the echo of trauma into a symphony of healing and hope.